Obesity is far more than an issue of body weight. It's a metabolic disorder that rewires how the body processes energy, often leading to insulin resistance and persistently high insulin levels. This silent hormonal shift doesn't just increase the risk for type 2 diabetes, it also creates a fertile ground for some of the deadliest and most aggressive cancers, including pancreatic and liver cancer. The warning signs are clear, yet routinely ignored. High insulin isn't just a marker of metabolic disease, it's a trigger for malignancy. In insulin resistance, the body's cells no longer respond effectively to insulin, the hormone responsible for shuttling glucose into cells for energy. In response, the pancreas is forced to produce more insulin, leading to hyperinsulinemia, chronically elevated insulin levels in the blood. This condition is extremely common in people with obesity, especially those with excess visceral fat. And while this may seem like a purely metabolic problem, its impact on cancer biology is profound and disturbing. Insulin, along with insulin-like growth factors, IGFs, does more than regulate blood sugar. It also acts as a potent growth hormone. In high concentrations, it stimulates cell division, prevents cell death, and increases inflammation, exactly the conditions cancer needs to grow and spread. Pancreatic and liver tissues, which are already under stress in obese individuals, are especially vulnerable to this hormonal assault. Pancreatic cancer, in particular, is now closely linked to obesity and insulin resistance. The pancreas, forced to overwork for years in a state of metabolic overload, becomes inflamed, damaged, and ultimately more prone to cellular mutations. Over time, this inflammatory and hormonal pressure can initiate cancer in the very organ that has been struggling to keep blood sugar in check. And pancreatic tumors fueled by high insulin levels tend to be more aggressive, harder to detect early, and resistant to treatment, contributing to the extremely poor survival rates associated with this disease. Liver cancer follows a similar trajectory. In obese individuals, the liver is often infiltrated with fat, leading to non-alcoholic fatty liver disease, NEFLD, which can progress to non-alcoholic steatohepatitis, NASH. In this state, the liver is inflamed, scarred, and surrounded by pro-growth hormones like insulin and IGF-1. This environment significantly raises the risk of liver cancer, and again, tumors tend to be more aggressive and often discovered too late for effective treatment. Despite the clear links, insulin resistance is rarely treated with the seriousness it deserves in cancer prevention strategies. While blood sugar is routinely monitored for diabetes risk, insulin levels are often ignored, even though elevated insulin may signal cancer risk long before glucose levels rise. Public health campaigns remain focused on calories and weight, rather than the biochemical chaos happening inside the body of someone living with obesity. Even within the healthcare system, few physicians explain to patients with obesity that their high insulin levels are not just a metabolic concern, but a carcinogenic one. Most are unaware that their pancreas is slowly wearing down, or that the hormonal storm surrounding their liver may be pushing them closer to cancer. This lack of communication and lack of testing represents a massive blind spot in preventive care. The longer insulin resistance is allowed to persist, the higher the risk for cancer. And the tragedy is that this condition is often reversible with early intervention. Lifestyle changes such as weight loss, improved diet, and increased physical activity can restore insulin sensitivity and dramatically reduce cancer risk. But without awareness, those changes rarely happen, and the damage quietly continues. Pancreatic and liver cancers are among the most lethal, not just because of their biology, but because by the time symptoms appear, it's often too late. The opportunity to prevent them lies in identifying and treating insulin resistance early. Obesity isn't just increasing the odds of getting cancer, it's accelerating the timeline. Without bold, systemic changes in how we screen, educate, and intervene, we are sentencing millions to a future where the link between metabolism and malignancy is realized only when it's far too late.